The enhanced recovery programme did help me to get home quicker, and the fact I've got to think about hospitals, I was glad of that. But I also felt better that I was somewhere where they knew exactly what was wrong and they knew what they were doing for me. It is such a good thing.
The enhanced recovery programme made my experience a lot easier than what I expected. I had such a lot of support.
The enhancement programme which I attended made the operation less stressful for myself.
Enhanced recovery is about reducing the stress of an operation, making you comfortable, building confidence to recover quickly, reducing complications, and in effect, getting you ready to go home quicker.
It involves multidisciplinary teamwork where you are the leader of the team.
Coming to hospital for surgery is a stressful situation. You are already preoccupied with lots of information. However, it's really important and good to know beforehand what's expected.
That's why we are here to give you a realistic picture of how you can get back to your normal life quickly in a safe and effective way. The process starts well before your operation.
Smith, would you like to come through?
Before coming for your operation, you may see a nurse specialist, depending on whether this is deemed appropriate for you. The pre-assessment nurse, together with the consultant surgeon and anaesthetist, will go through various aspects of your treatment and also explain about enhanced recovery.
The days are gone when you had to starve for hours before an operation. We encourage you to drink up to 2 hours prior to your surgery. We provide you with carbohydrate drinks to boost your energy levels, as well as impact drinks to reduce post-operative complications. For colorectal surgery, we won't routinely prescribe full bowel preparation such as Picolax to drink. However, in some cases it is necessary and we will advise you accordingly.
For patients having colorectal surgery, the pre-assessment nurse will also provide the enhanced recovery diary, so you are familiar with it. You will take it home and bring it back with you on the day of your surgery. We will mention its importance a little later.
A cardiopulmonary exercise test at the time of pre-assessment predicts the risk of undergoing the surgery. It allows your anaesthetist and surgeon to take appropriate measures both before and during your operation in order to reduce the risk of complications. It also allows us to determine whether your immediate post-operative recovery should be on the high dependency unit, the nurse enhanced unit or high observation bay, or the general ward. There are several other measures related to the anaesthetic and surgical techniques that will be used to help in your recovery. During your operation, we use advanced monitors that show us how much blood your heart is pumping around your body. This tells us how much intravenous fluid you need and ensures that you are given just the right amount. Getting this part of your anaesthetic absolutely right is crucial, as it helps to stop fluid accumulating in your body and bowel, and this means that the bowel tends to function earlier, meaning you make a quicker recovery. Your anaesthetist will talk to you before your operation about the best type of pain relief for you to have after your surgery. Before the introduction of the enhanced recovery programme, most patients had either intravenous morphine or an epidural for pain relief. A lot of patients will still be offered an epidural, but in some, particularly those patients undergoing laparoscopic surgery, the anaesthetist might suggest having a spinal anaesthetic instead. Needless to say, all patients get a general anaesthetic, so are fast asleep during the actual operation.
Your surgeon will advise whether a laparoscopic approach would be beneficial for your operation. This will not always be suitable and will depend on several factors. Laparoscopic surgery, often referred to as keyhole surgery, will result in earlier bowel function and quick recovery.
Having a spinal anaesthetic avoids the need to have an extra attachment of the fine epidural tubing at your back, meaning you are more free to move. The intravenous fluid drip and the urinary catheter in your bladder can come out early as well. We aim to take down everything on the first day following your operation. It gives you comfort and helps you mobilise early. It goes without saying that adequate pain control is of prime importance during the whole process.
We will aim to control your pain following your procedure, and your pain experience will be regularly assessed by the staff. Pain will be assessed using a numerical scale, both at rest and movement, and pain relief administered regularly or on an as required basis. You may have a patient-controlled analgesia, which is a machine that you can use to deliver pain relief through an intravenous drip. You may have an epidural, which involves a fine tube in your back that delivers drugs for pain relief, numbing the wound area. You will then take painkillers by mouth on day 1. You'll be given painkillers that won't delay your bowel function. The acute pain team will visit you on the ward to assess and monitor your pain management. But you should let the ward staff know if pain is limiting your ability to mobilise or recover from your operation.
One of the most valuable aspects of enhanced recovery is to get you back on your feet as soon as possible. Our physiotherapist will assist you with mobilisation and breathing exercises.
From day 1, in order to achieve an enhanced recovery, we will encourage you to follow simple breathing and circulatory exercises. We will also encourage you to walk further along the ward corridor each day. This will prevent serious complications such as a chest infection, DVT, and also boost your appetite. It results in earlier bowel activity and an earlier return to home. We will achieve this together in a completely safe and relaxed environment.
With reference to bowel function, those of you who will need either a temporary or a permanent stoma will be supported by our stoma nurse specialists. At pre-assessment, the stoma nurses will offer you a practice pack which contains information about stomas and sample bags.
After your operation, within the Enhanced Recovery Programme, you will be supported by the ward staff and the stoma nurse specialist to help you care for your stoma. Using and building on the skills and familiarity with the bags you have gained at home will help you towards your early discharge from hospital.
It is extremely important for you to take an active role in your recovery. We would encourage you, and possibly even nag you, to fill up this enhanced recovery diary on a daily basis. This is to help you achieve your milestones during your stay in the hospital. The diary will be kept at your bedside for your easy access.
The diary also gives us an opportunity to monitor your progress and make changes that will improve your care. The feedback from you will prompt us to alter or amend things to make your recovery from surgery even better and more effective. Please ensure that you've made adequate plans so you can be discharged as soon as we feel it's safe.
For cancer patients, the colorectal nurse specialist is your key worker and first point of contact for any issues or concerns relating to your pathway.
Your nurse specialist will usually see you with your consultant to talk about your surgery, both in clinic and on your admission. You'll be reminded about the Enhanced Recovery Programme on completion of the diary. You will also be seen on the ward after your operation and before you discharge with written information to help continue your recovery once you're home.
Enhanced recovery is not only about early discharge from hospital, it is about your experience of the post-operative days in hospital.
As you can see, this process is what both you and I would wish to be the norm. There's nothing complicated about it. It's about reassuring you as to the nature of your recovery. It's for your benefit. Of course, we're here to help you, but your participation is absolutely vital to its success.
The Enhanced Recovery Programme, you're monitored all the time, so you're very safe.
Instead of just laying in bed and thinking what am I going to do, I looked at the booklet and think, well, yeah, I've got to do this today, and I was off. And I thought that was great because that was an incentive for me to get out of the hospital quick, and I adhered to everything they asked me to do, and I think that was a good thing for my recovery actually.
When I came around from the operation, they told me that I would go home on the Friday. I made such good recovery that I actually went home on the Thursday morning. So all this help, support really helped, and we were just so overjoyed that I could get home.